I'm Lorraine Ho from Bootcamp Ireland, and here we are to do more winter files on how to get the best of your winter training. Here we are with Kevin Toole from Fitzwilliam Health Clinic, and he's going to go through some of the common injuries that people get when they're doing their winter training from not warming up properly, not stretching properly. So here we are, Kevin.
Hello everybody, my name's Kevin Toole from the Fitzwilliam Health Clinic. What I would like to talk to you now about your winter training tips is not stretching properly and the results of not stretching properly, i.e. muscle strains and tendon or ligament joint sprains. The first one I'm going to talk about is a muscle strain grade 1, which means you've overstretched the muscles and you've got some slight little micro tears. You stop your training, you protect it by not doing any more exercise, you rest it, so that means you've got to rest it for 24 to 36 hours. You ice it, which means you put an ice pack on it for about 15 minutes every 4 to 5 hours. Remember, do not put the ice directly onto the skin, it must be wrapped in something, a tea towel, a tubey grip, something like that. And then if you have some tubey grip or bandage, you wrap that around the injured part of the muscle. After 36 hours, you reassess it. Is it improving? If it is improving, it's a grade 1, and then you can start back with some gentle exercises, which I'll go through later with Shelley. Or if it's not improving, then you've got to seek some medical advice. We're now talking about a grade 2 and a grade 3 strain to a muscle. It takes longer. You've got to be aware that you still will have a little bit of difficulty if you try to jog or run for the bus or step up onto the Lewis. It'll still hurt. So therefore what you've got to do is get some more advice. You've got to ease off on the training. You can do non-weight bearing sports. You can go cycling, you can go swimming, but you can't go running. And until you can walk for about half an hour to 40 minutes, then you can't go jogging. And when you go jogging, when it is getting better, you have to do gentle jogging. You can't go back to doing your grid sprints and all the really fast runs that you would normally do. You've now iced your muscle strain for approximately 36 hours. You feel it's getting better. You can now start from day 2 onwards. You can start doing static stretches where you do a gentle stretch. You mustn't hurt. You do a gentle stretch, and what you do is you hold that stretch for 25-30 seconds. You can start doing little gentle exercise, a little bit more walking. Start walking up a few more stairs. Start striding out a little bit more and start to just exercising the muscle without causing yourself any pain. And what I'll do now is I'll just show you some nice static stretches for calves, quad and ham. Your leg is now improved after your 36 hours of rest and your P.R.I.C.E routine. Imagine here, and we'll use Shelley's leg as an example, she has strained her quadricep muscles on the left hand side here. So what she needs to do is just do some static stretching. Static stretching for Shelley's quad would be this position here and just gently pull back the knee. If you find that even that hurts, what you can do is use a towel, piece of rope, put it round the ankle, grab and just gently pull up. And all you do on this stretch is that you hold this stretch for approximately 30 seconds. You don't hurt yourself, it's a gentle stretch. And you do this 5 to 8 times a day. That's all you've got to do. You don't do repetitions. And you let it lower back down, and then you would back up. And you just do this gently. When you can do all your static stretchings, then you can do as we said before, non-weight bearing activities. You can do swimming, you can do cycling. If, for example, you have strained or pulled your calf muscles, we go into a static calf stretch. The way you do that is, as Shelley's demonstrating, is just one leg forward, keep a nice straight knee, and gently go forward until you feel a stretch. If it's the top 2 calf muscles, we keep our knees straight. If it's the bottom 2 calf muscles, we keep the heel down and we slightly bend the knee so you feel the stretch down there. Again, it's 5 times a day. Hold each stretch for 30 seconds. We're now going to talk about Shelley having pulled a hamstring. So if she lies down in the privacy of her own home and she raises her injured leg and she feels a stretch on a hamstring. If the hamstring only comes up as far as there, that's absolutely fine. You don't strain the muscle. If she finds it difficult holding there, what she can do is use a towel or a piece of rope and just gently pull. If you find that you've pulled the muscle more up towards the top end of the muscle, what you can do is use your towel piece of rope, but bend your knee. And now where you put the emphasis on the strain is up here. So you get a nice stretch there. Again, you hold for 30 seconds, and again you stretch at least 5 times a day. What we're going to talk about now is another common injury that we get, which is sometimes called runner's knee or iliotibial band syndrome. The iliotibial band is this banded fibrous tissue that goes down here, controlled by a muscle called the TFL, and it causes pain around this outer side of the knee and causes pain around the kneecap. The way we get rid of this is to look at the footwear, don't do so much downhill running, look at our gait, and also do an awful lot of stretching to this iliotibial band. What we're now going to talk about is stretching the muscle that controls the iliotibial band. And as you can see, Shelley has adopted a nice comfortable position, the outstep of the stretching foot, and what we have is a nice straight leg, and the fibrous band, the iliotibial band, is here and controlled by the muscle, which is that part of the hip on this side. And what she does is make sure that she's balanced on the couch. This leg is comfortable and she's not hurting her back, and what she does is drop her hip into the stretch, and then she can move her hip round so that she feels the stretch over the TFL. That's the muscle that you must control, that controls the ITB. By stretching out this muscle, you will take the strain off here, which will take away your runner's knee pain. To wrap this up, what I'd like to emphasize to people is, even on the days when you're not training, you're not running, you're not attending your boot camp class, if you're feeling a little bit tight in the muscles, what you must do is stretch. Walking to and from work, going up and down stairs, walking around the offices, using the muscle. So on the days that you don't train, please stretch.